My name's Tena Walters. I'm a consultant breast surgeon. I've been a consultant breast surgeon in Harley Street for the past 23 years, and I look after ladies with breast problems and particularly ladies with breast cancer. One of the issues that we have in managing patients with breast cancer is that some cancers are sensitive to estrogen, which means that in order to stop the breast cancer from spreading to other parts of the body, we need to control estrogen, which means precipitating women into the menopause. This sometimes happens following chemotherapy, as the ovaries function less well following chemotherapy. Sometimes it's part of the natural process into menopause, and sometimes we have to give drugs which cause menopausal symptoms. We then can't use HRT to treat those symptoms because obviously that would stimulate the breast cancer. My first experience of the LadyCare device was from one of my patients who told me that her menopausal symptoms, which can be night sweats, hot flushes, weight gain, joint pains, difficulty sleeping, anxiety, were very much helped by this device, which is called the LadyCare device. Coincidentally, one of my colleagues then asked me for some advice on the management of her menopausal symptoms, and I told her about the story about the LadyCare device. When I saw her the following week, she almost knocked me over. She was so pleased with the effect. She said she'd been sleeping really well for the first time in months. Her hot flushes had settled down, and so therefore I decided, because we can't use HRT, we can't use estrogen medication for these women who have had to have their estrogen levels dropped for the management of their breast cancer, there were very, very few other alternatives. In the past, we've used drugs which have effects on each of the individual symptoms, but nothing which helps the whole syndrome. And the LadyCare device has a very good effect, and in my experience, has an effect on a large number of women. I therefore suggested to some of my patients that they should try this device with excellent results. Some women benefit enormously and very, very quickly. A study has been undertaken of 508 women, which has been published in the European Journal of Surgical Oncology, which is a peer-reviewed journal. And this study was a cohort observational study and showed that about 25% of women had moderate benefit after 1 month, and about 25% of women had significant benefit from using the LadyCare device after 1 month. But after 3 months, 25% of women had moderate results and 50% of women had good results. I do carry on recommending the device to my patients and to colleagues and friends, and I continue to have very good feedback. One of the best things about the LadyCare device is that, of course, it has very few side effects, unlike many other treatments for the symptoms of anxiety, night sweats, hot flushes.
I have very good experience with LadyCare because I started to use it for my family, and in my family it was so dramatic improvement that it was taking me to the idea to bring it to my clinics in Czech Republic. And I am satisfied because my patients are satisfied. I have feedback, around 80% is dramatically improved, and they are giving me many thanks for that. So that is why that I am using it and recommending to my patients. So, to placebo effect, if it is so placebo effect, it's really dramatic placebo effect. 80% of successful rate, yes, it is really dramatic.
In 2005, I was involved in publishing a double-blind placebo-controlled trial which showed that the LadyCare device was very effective, in fact, in 4 out of 5 women, in relieving period pain. As the device continued to be used by many women, some of whom were what we call perimenopausal, which means they were still having period pain and were wearing lady care for that, but were starting to also enter menopause, so were having menopause symptoms like hot flushes and emotional disturbance. We started getting some of those women reporting back that their menopause symptoms were being relieved significantly by wearing the lady care. Well, this was, of course, particularly difficult to explain. We could sort of guess that wearing a device in the underwear, we could surmise why that might relieve period pain because it's in the local area. But why would wearing a device in the underwear actually relieve menopause symptoms? This was a puzzle. So we decided to investigate this further, and we studied, in an observational trial, we studied 508 women who had not worn the lady care device before, but yet all of them had to have significant menopause symptoms. We monitored 23 different menopause symptoms over a period of 3 months. And what we found from that observational study was that between 72 and 75% of women had significant relief of the majority of their menopause symptoms. Now, we have had, it's fair to say, a fair amount of criticism and of doubt from scientists and doctors as to the genuineness of these results. Some say, well, we haven't done a double-blind trial, or that actually this is probably just a placebo effect. So my response to those comments are these. Firstly, the original trial that we did on lady care was indeed a double-blind placebo-controlled trial. And yes, we were studying the relief of pain, yet we established a clear physiological benefit of lady care in this scenario. Second, some of the women in the trial and subsequently have had intrusive menopause symptoms, sometimes 20 or more hot flushes a day. And some of those women have reported back to us that within 48 hours, they have no hot flushes. Now, it's a little inconceivable to think that this might be a placebo effect, given this dramatic change around. Secondly, this level of effectiveness of between 72 and 75% is particularly high for a placebo effect. So it's unlikely that this is just down to placebo. Furthermore, we did further studies where we've looked at and measured a real effect of lady care on the autonomic nervous system. So we have a plausible explanation from these studies of how lady care is likely to be creating its benefits. On top of all of this, it's important to say that in all of these observations and studies, we have never observed any side effects from women wearing lady care. That's a very important observation. I'm going to repeat it again. In all of the studies on lady care, we've not observed any side effects from wearing the device. That is as important as monitoring its effectiveness. I want to add one other response to people who question the fact that it hasn't a double-blind trial as far as menopause symptoms are concerned. We can also observe that, for example, smoking has no double-blind trial that shows that it's associated with cancer occurrence, and yet we accept this as fact. And the reason for this is that the weight of evidence, the weight of observational evidence around this supports the fact that smoking is associated with cancer. We now accept that as fact. It's not always necessary to have a double-blind trial to confirm a particular finding. So what I would argue is that all of the observations that have been made with lady care and the trials that have been done, there's a weight of evidence that supports that lady care has a real, genuine benefit, and it continues to help a lot of women. Finally, yes, I do recommend lady care to many patients based on, one, its effectiveness, and two, its safety. many women are benefiting and have benefited from wearing the Lady Care who could not take hormone replacement therapy or would not take hormone replacement therapy for their symptoms. So for those particularly, Lady Care is something well worth them trying.
Lady Care Plus is a small, powerful, drug-free device that could help reduce the symptoms of perimenopause and menopause. It's used by over 500,000 women in the UK alone. Using the enhanced power Lady Care Plus may help to reduce or completely alleviate stress, hot flushes, bloating, palpitations, vaginal dryness, anxiety, and over 23 other symptoms, completely safely. Just separate the button from the larger pear-shaped piece. Place the curved face against your skin around 4 inches below the navel and attach the small button on the outside of your underwear. It is important to wear the Lady Care Plus at all times and only remove for bathing. Over 71% of women who use Lady Care Plus feel its benefits within the first couple of weeks, and others need to use their Lady Care Plus for the full 3 months. For a full list of symptoms and for more information on the Lady Care Plus, visit the Lady Care website.